This is chapter 1. We are going to cover an introduction to the human body and go over some of our basics to get us started for the whole semester. So welcome to A&P 1, chapter 1. In this lecture, we are going to cover sections 1.1 through 1.4. The rest we will cover in lab. So we're going to go over our basics of anatomy and physiology, discuss the organization of the human body, go through what characteristics make something living versus non-living, and then jump into homeostasis, which is an overarching topic that we will see in each additional chapter of our book. So when we are talking about anatomy and physiology, we are looking at the structure and the function of the human body. So with everything in the body, structure is really the basis of function. Why the tires on your car are circles versus triangles, the circles roll down the road better. Everything in the body is made that way too. Its structure is made for its function. So we're going to look at those main structural components, mostly in lab, and then we will look at how they function and start working together in lecture. Starting with our basic definitions of anatomy and physiology. Anatomy is the study of the structures of the human body. So the actual pieces and parts of the human body that we're going to name, such as your humerus and your femur, which are bones that we find in the arm and the leg. Again, we're going to cover mostly anatomical terms and structures in our lab time. And then in lecture, we will go over the more detailed physiology processes, the actual functions of how those body structures work. So really important to note the difference to those, and that's kind of how our lab and lecture will be divided. Starting with just some basic organization of the human body. We are going to start this semester and our journey through A&P 1 and 2 at the smallest level that we have, our chemical level. So in chapter 2, we will start talking about atoms and molecules. We will look at the elements on the periodic table and discuss how those elements are bonded together to form those small structures of the human body. We will then in chapter 3 get into the cellular level of organization, where we talk about what's inside of a human cell, what makes a human cell different from a plant cell, and why do we have certain structures in different human cells. Then in chapter 4, we will get into our tissue level of organization. So we'll put some cells together and make a whole cohesive unit of a tissue. Then we will take those tissues and put them together and make organs. So your organs, like your stomach, are made of multiple different tissues. So we're going to look at those tissues in detail and how those layers are organized to make up that entire organ. Then this semester, we will be getting into some organ systems where we look at multiple groups of organs and how they work together to achieve a common goal. And then finally, at the end of A&P 2, we will officially have made an entire organism, a human, from the ground up. So that's kind of where we are going over the next 2 semesters. This semester, in A&P 1, we will be looking at 4 different organ systems. So we're going to cover our chemistry of the body, so those atoms and molecules. We'll then get into our cells, our tissues, and then finally we'll start an organ system. And we're going to start off with the integumentary system, the skin. The integumentary system is our largest organ system in the whole body because it covers your entire body. So we are going to look at all of those layers of your skin and soft tissues and talk about how they protect our body and how we have different tissues in different places in our skin. We will also look at the skeletal system, our bones, which really give us our framework and allow us to be able to move, as well as that muscular system that allows those muscles to move. So we will look at that muscular system in detail in lecture and lab. And then finally, we will end on our nervous system unit, where we will cover the brain, the spinal cord, all of those nerves throughout your body and how they communicate with each other. And we detect sensations and then are able to form actions based on that information. So that's what we were looking at in A&P 1. In A&P 2, we will get into all of the rest of those organ systems, cardiovascular system, which includes your blood, heart, and blood vessels, your respiratory system, which has your lungs and tubes to breathe. We will look at our endocrine system and our hormones, as well as our digestive system, where we break down and absorb our nutrients, our reproductive system, where we will talk about how human cells are able to reproduce and make another human, The urinary system, where we are able to excrete a lot of our waste products, maintain our pH, and deal with the fluid balance in our body. And finally, we will end with that lymphatic system, which is your immune system, and on what kind of helps protect us and keep our body free from pathogens, which is a great setup to lead you into microbiology if you'll be taking that course, where you'll start talking about all those little pathogens and bacteria, viruses, and parasites. So lots upcoming in the next 2 semesters. Again, this semester we will focus on all of the smallest parts of organization, as well as the integumentary system, skeletal system, muscular system, and nervous system. So let's get into the characteristics of what makes something living. So for something to be considered alive, like a human cell, it must be able to undergo the process of metabolism. We'll talk about metabolism in more detail on the next slide, but metabolism is really the sum of all of the chemical reactions in our body. So how our body is functioning on that chemical level every day. We'll talk a little bit about this in chapter 2, and then we will have an entire chapter on metabolism in A&P 2 eventually. For something to be considered living, it also must have the principle of responsiveness, meaning it's able to respond to stimuli from the external or internal environments. So for example, if you put your hand on a hot burner and you move it away quickly, or you step on something sharp and you pick up your foot quickly, all of that is responsiveness. You are responding from some sort of external or internal stimuli. For something to be living, it must not also respond, but also be able to move or have the ability to move. We don't need to just move our arms and legs or different body parts like that. When we are thinking about movement, we need to be able to move blood around our body. So our heart has to be able to pump that blood. We need to be able to move air in and out of our lungs so we can breathe. So we have a lot of movement on smaller scale levels as well that we'll be talking about as we go through our 2 semesters. For something to be living, it also has to have the ability to grow. And we will talk a lot about growth and cell division in each organ system and how do those cells start out in the fetus, as well as what happens to them as we get older and we are aging. So we'll talk a lot about that growth, as well as that change in our cells called differentiation. So for something to be alive, its cells also must be able to differentiate, which is another way to say specialize. Those cells must be able to specialize from a kind of wide category cell called a stem cell that has lots of potential to do different things. And then when it's put in the correct environment, it will differentiate or specialize into whatever cell is needed in that area. And we'll talk a little bit about this in the next 2 slides as well. And then finally, another characteristic of a living organism is something that has the ability to reproduce. And that doesn't mean that it has to reproduce. It just means that it may have the capacity of reproduction, where there are some types of cells present in that organism that could potentially have the possibility to reproduce at some point. So let's look at a few of these in more detail, specifically starting with our metabolism. So metabolism is the sum of all of the chemical reactions that are occurring in the body every day. We have 2 main types of those chemical reactions, and you're going to notice that these are going to involve things getting bigger and then breaking those bigger things down and making them smaller. So our anabolic reactions, or anabolism, are reactions where we have this large buildup of larger molecules from smaller pieces. So you can see in that first picture there that says anabolic reaction, we are taking small atoms and we are putting them together with a little energy and making a larger molecule. So this is just like if you're building a tower out of blocks or Legos. You're going to have all those little itty bitty pieces, and then you're going to stack them up or build them into a larger structure. That usually takes a little bit of energy and effort to do that, versus our catabolic reactions, which are where we are breaking those large molecules down. Those catabolic reactions involve releasing energy as we are breaking those bonds in between those small atoms and releasing them into their individual pieces. So you can think about this like when you eat your breakfast in the morning. So if you eat a bagel or a donut or a Pop-Tart for breakfast and you eat that large structure, Your body works to break it down. You chew it up with your teeth, your stomach acid helps break it down a little, and then further off you have enzymes that individually break that large piece into its smaller particles. Your body is then going to use those small molecules and undergo anabolic reactions to build up your larger tissues each day. So to help maintain your muscle mass, to help maintain your skin cells as they are exfoliated. So your body's going to take those small things and then make them big. So your metabolism is really a balance every day between the breaking down of large molecules to small ones and then taking those small pieces and building them into larger molecules every day. We will talk about this a little bit more in chapter 2 when we get into more of that chemical and atomic level of organization. Next, we're going to briefly talk about cellular differentiation. So all of the cells of the body start as what we call undifferentiated stem cells, meaning they have all of the things that can become a human cell, all the components of a human cell, but they have no direction yet. Once that cell is given some direction or guidance or correct environmental factors, that cell is going to specialize or differentiate into a specific type of cell for a certain job. So you can see this little undifferentiated stem cell here has the potential to become 3 different types of cells depending on the environment and mechanical characteristics provided to it. So if that little undifferentiated stem cell ends up in a stiff environment, and that doesn't allow for much growth, that means it's going to maintain that small cell size and has a possibility to differentiate into a bone cell. We're going to look at this process in detail in just a few weeks, but our bone cells really stay in small, tight areas, and they maintain that same cell size throughout their lifetime. If we look at the undifferentiated stem cell now living in a highly viscous environment, that's going to give that cell a little bit more room to move, as well as become a little bit more bouncy. So we can see stem cells that live in highly viscous environments become cartilage cells, possibly, like at the end of your nose or the tips of your ears. If we have an undifferentiated stem cell that is soft and in a environment that has a lot of room to grow to become a larger cell, this cell may have an increased differentiation potential to become a fat cell or adipocyte. We will also look at these in our connective tissues unit and talk about how those cells develop as well. So again, really every cell in your body is going to start from the same pathway, and it's just going to depend on what environmental factors, mechanical characteristics, and what cell signaling is sent to that cell for what it's going to become. And we're going to look at this process in every chapter that we go through and talk about the specific cells involved in that tissue and where they came from. Okay, let's get into our largest topic of chapter 1, homeostasis. Homeostasis, by definition, is maintaining a stable internal environment so that your body processes can occur normally. So we know that we can measure vital signs So when we are looking at homeostasis, we are really evaluating normal conditions inside of the body and the set controls that they work at. So we know that we can measure our vital signs like temperature, heart rate, blood pressure, respiratory rate, and we have put normal values on those vital signs. Your body has done that well before we put numbers on them. The body knows what pH the blood is supposed to be. The body knows what the set heart rate should be if you're at rest, or your respiratory rate, or the rate of urine production. The body knows how to work. It's very efficient like that. So to be able to alter these things when they kind of get some kind of change that is causing them to be out of their normal set range, your body has feedback systems to be able to interpret that information, cause a change, and then hopefully restore that information back to normal. So as we are looking at our feedback systems, we're going to look at 6 main parts of a feedback loop. We have 2 types of feedback loops, negative and positive, and we're going to work through examples of each of them on the next few slides. This slide is going to cover just the 6 basic parts of our feedback system. And we're going to always start with a stimulus. A stimulus is something that causes a change in a normal condition. So you are going to have some sort of normal set condition, and we are going to have something that causes that to be increased or decreased above or below normal. That condition that we are evaluating is called our controlled condition. This is any condition in the body that needs to be within some type of normal range for homeostatic functioning. To detect changes in that controlled condition, we have things like receptors. Receptors work like a smoke detector in your house or in our classroom, where that device is just there. It is quiet. You barely notice it. It doesn't seem like it's doing anything until there's the presence of smoke, and then it sounds the alarm and alerts you that that is there. That's exactly what receptors do on our body. They are really just kind of lying in wait in strategically placed places throughout the body that are able to detect these changes, and then when they do, they're going to send that signal to what we call the control center. The control center is what's going to interpret that information from our receptor and make a decision based off of it. So do we need to respond to this information or not? That's how we're going to kind of weed out any stimuli that aren't super important or aren't necessary for the body to make an immediate response to. The control center is going to many times be the brain in our examples, but will also has the ability to not be the brain and can be pretty much any other organ in an organ system. And we'll talk about a lot of examples as we go through our next 2 semesters. Your brain sends information out to things called effectors. These are organs and tissues that can cause the response, and the response is based off of the information from the control center. It's basically, what are we going to do about this problem, or what are we going to do about this change? How should we react to it? So for every feedback system that we go through, you definitely want to know all 6 parts of a feedback loop and what they do. We're going to start going through our negative feedback loop now. Negative feedback loops are things that return your altered conditions to normal. These regulate long-term stable conditions and are going to be the majority of the feedback loops that you see. What happens is we're going to usually have a stimulus in one direction, and then your response is going to cause that change in the opposite direction, which will turn this condition off. We'll turn this whole feedback loop off, and everything will be reset back to normal. In this example, I use the stimulus of exercise. So as you exercise, you increase your body's temperature. Our controlled condition is our body temperature. It should normally be within about 98 to 100 degrees Fahrenheit approximately. And when that temperature changes, you have something called thermoreceptors, which are temperature receptors, and there are some in your skin. So as you're exercising and we are increasing that controlled condition of our body temperature, our thermoreceptors in our skin are going to be activated and send a signal into our control center, the brain. The brain is then going to send a signal based on that information out to our effectors. So the brain is going to interpret that input in from our receptors and say, yes, the body is too hot. We need to get back into our normal body temperature range. To do that, we need to send a signal out to our effectors, our sweat glands, and our blood vessels. In response to that information from the brain, our sweat glands are going to begin sweating, so releasing a liquid fluid onto the surface of our skin. As that fluid interacts with the air in our environment, it's going to cool the body down. Our brain is also going to send a signal out to our blood vessels as an effector and causing them to vasodilate, which means get larger. This is going to help send more blood to the surface of the skin, allowing that heat to dissipate off of our skin. In the result of the sweat glands and blood vessels working together, our body temperature should decrease back to normal, and it should stop or turn off this feedback loop. There is an example of blood pressure as a negative feedback loop in your PowerPoint as well as your textbook. So check that out as well. Let's compare and contrast that now to a positive feedback loop. So our positive feedback loop is going to increase or enhance the stimulus. So you are going to notice the stimulus and the response are going in the same direction. The response is really kind of reaffirming or increasing that stimulus. This is a very rare feedback loop. We only see this in short-term conditions. There are 3 that we will learn over the next 2 semesters. The one on this slide and that we will go in depth more in A&P 2 would be childbirth. We also will see this with allergies, which we'll talk about in our immune system. If you've ever had a bug bite or a rash or itchy, watery eyes and you itch them and they itch more and more, that's a positive feedback loop, as well as blood clotting, which we'll go over in our blood chapter of A&P 2. But if you've ever cut yourself while cooking or shaving and you've taken a paper towel or a napkin and kind of dabbed over that, waiting for that bleeding to stop, what you are really waiting for is your platelets, a special cell in your body, to kind of accumulate there and block up that hole. So we'll talk about those positive feedback loops more next semester. Let's just use childbirth as our example today. So our stimulus for childbirth is once that baby is all done cooking in there, so about 40 weeks, the baby's head will move into position. So they should move down and towards the cervix, which acts like a little lock on the uterus. A baby is growing inside of an organ called the uterus, and it looks like a big empty basketball. That basketball is made of muscle. So the baby is really growing in a big hollow ball of muscle. And to keep that baby in there for those 40 weeks while everything is growing and developing, there is a special organ on the outside called the cervix. This is going to keep that uterus nice and closed and keep that baby in there. Now, when that baby is fully grown and they are ready to be born, they're going to move their head down into position and it's going to start to stretch the cervix. Our controlled condition here would be the stretch on the cervix. It is usually not stretched. It is usually locked very tightly and the muscle is closed very, very tightly to prevent that baby from getting out of there. But once that baby's head is in position and starts to push on that cervix, it will start to stretch it. And there are special stretch receptors in the tissue of that cervix that are detecting that stretch. And they're like, whoa, they can feel the weight of the baby's head and the stretch from the baby's head. And they're going to send a signal into the brain that says, hey, this baby is fully grown. Everything is ready. We are ready to deliver this baby. So the brain is going to release a hormone this time. That hormone is called oxytocin. And oxytocin is a special hormone that goes specifically to that muscle of our uterus. So it is going to go to the muscle tissue of the uterus, which is our effector. And in response to that oxytocin, the uterus muscle is going to contract. So just like when you lift weights at the gym and you lift up a weight and your muscle contracts, the same thing is going to happen here, but our stimulus is just a hormone called oxytocin. This causes the uterus to contract and push on that baby. As it does that, it's going to push the baby's head further into the cervix, and the cervix is going to stretch a little bit more. As this continues to happen, that is going to send a signal back up to those send a signal from the stretch receptors back up to the brain and say, yes, there's more stretch on the cervix. The baby's head is here. It is ready to come out, but the cervix is not open enough. So the brain is going to release more oxytocin, and we are going to do this over and over again as labor contractions get stronger and closer together until finally that whole cervix is stretched or dilated to about 10 centimeters, about the lid of a pint-sized thing of ice cream. So then that baby can officially fit out of that cervix. And now when the uterus contracts, it's going to push on that baby, and that baby's going to come on out of there. This is then going to, after that baby's born, slowly be turned off. So it must be turned off by something outside of that system. So the baby is physically born. There is now no baby in the cervix or the uterus pushing on anything. And that is going to slowly turn this loop off, and everything will shrink back down and go back to normal. So again, main difference between a negative and a positive feedback loop is that a negative feedback loop's job is to respond in the opposite direction of the stimulus and restore that condition back to normal pretty much immediately. A positive feedback loop is going to enhance or increase that stimulus over and over and over again until something else happens or our goal is met. So be able to work your way through positive and negative feedback loops. You want to understand all 6 parts of your feedback loops, as well as be able to outline an example. Okay, so why did we talk so much about homeostasis? Well, because of things called homeostatic imbalances. So when one part of the body loses its ability to maintain homeostasis or function correctly, it can lead to more disturbances throughout the body, which is where we really get that whole kind of picture of a disease or a disorder, where we get those characteristic signs and symptoms, and we are able to classify that as our disease or disorder. So for example, in diabetes, our issue is actually the pancreas and our insulin. But by having that pancreas not work correctly and our patient's blood sugar be uncontrolled, that can damage their retina of their eyes and their kidneys, as well as their heart and several other tissues. So when one little piece of the puzzle doesn't work correctly, it starts to kind of ricochet or ripple throughout the body and cause lots of problems. And why our patients come to see us is usually because they don't feel right. Something is wrong. So a lot of times we are looking at a disorder. A disorder is any kind of abnormality in the structure or function of a tissue. So for example, diabetes is a disorder. There's something not working correctly with our patient's pancreas. Heart disease is a disorder. There is something abnormal in the structure or function of our patient's heart. Or an arrhythmia that's an abnormal heartbeat. Again, something wrong structurally or functionally with that patient's heart. When we are looking at a disease, we are usually looking at a characteristic set of signs and symptoms. So we are really putting lots of puzzle pieces together here. We are taking a good history from our patient, we are doing a good physical exam, and we are getting some information from that patient. Again, sometimes symptoms and signs overlap very frequently. For example, the flu, a sinus infection, or a COVID-19 infection. Those are all treated differently, and they all have different causes, but they may have very similar signs and symptoms. Same thing with rashes, chickenpox, measles, smallpox. Those are all various rashes. And how we know which one our patient has, again, we look at the characteristic signs and symptoms. So symptoms are subjective changes. These are not apparent to different observers, meaning we cannot measure them. Your patient can tell us that they have chest pain, but we can't measure it. I can look at their heart with imaging or see how their heart is functioning with an EKG, but I can't actually evaluate their chest pain. There's no test for that. Same thing with a headache. You can tell me that your head hurts, and I can look at an EEG to see how your brain is functioning, and I can image it with the CT scan to see how the tissue looks, but I can't actually evaluate your headache. You have to tell me that. Same thing with visual changes. Yes, we can evaluate your patient's vision, but if your patient is starting to see spots in front of their eyes, or if they're telling you they can't see out one side of their eye or one visual field, we don't really have a test for that. We just kind of have to listen and record their symptoms. Signs, on the other hand, are objective changes, meaning we can observe or measure these in healthcare. So our patient's temperature, right? We can measure a fever. We can use something called an ophthalmoscope to look at our patient's retina in the back of their eye and see different changes related to disease processes there. And we'll do that a little bit as we get towards the end of our semester in our nervous system unit. We can also take a urine sample from our patient and dip it with one of those little sticks and evaluate lots of things, including protein, sugar, pH. All of those things are measurable and have a number value. We can also evaluate enlargement of organs like the heart with cardiomegalia, or the liver or a kidney, by measuring it and giving it a numeric value on imaging. So when we are looking at our patients and we are really evaluating what's going on and how we're going to best help them, we look at a lot of signs and symptoms. We look at sets of signs and symptoms and compare different disease states to what our patient's going through. We evaluate disorders for different abnormalities in structure or function with lots of imaging and evaluation. So that's what we're going to be doing throughout the rest of our semester here and in A&P2, is hopefully building a nice foundation for the rest of your career about what should normally be there. What should the structure and the function of the human body be? So that way that when your future patients come in with different diseases or disorders or signs or symptoms, you're able to understand what may not be functioning correctly. And then how are we going to diagnose and treat that problem? What imaging techniques would we best use? What lab values are most helpful? And then what treatment is and how that treatment is actually working to correct your patient's problem. So in this lecture, again, we covered chapter 1, section 1.1 through 1.5. The rest of that we will cover in lab. Don't forget you have learning objectives posted on your D2L to help guide you through this chapter. And onwards to chapter 2.